Today's short video on cephalosporin, a part of antimicrobial system. Cephalosporin it is classified into five generation. We don't have to remember all the names of the drugs, but here in the tabular form we are going to represent the five classes of drugs, their spectrum, use, and their some of the important drugs names. Generations, spectrum, use, and drugs. First generation, it is mainly effective for gram positive infection, staphylococcus, streptococcus, etc. Use, surgical prophylaxis. It is the drug of choice for surgical prophylaxis. It is generally given 30 minutes before the giving the incision. So surgical prophylaxis. Drugs, we had two modes of administration of drug, oral and parenteral. In the group of oral, there is cephalosporin, cephadroxil, third cephaloridin, and inside the parenteral only one drug we have to remember, cefazolin. It is most important, so we have to remember it, because in MCQ there is a probability of this drug to be asked in the questions, and there is a general probability how to identify in the MCQ. There is in all the drug there is the first starting with in the prefix cepha, so we have to remember that the cepha, whenever there is cepha, it is always included in first generation of cephalosporin. Only one exception, which is the drug cephaclor, which is included in second generation, but starting with the prefix cepha. So it is exception, and we have to remember in the exam. It is important. Now second generation is effective for anaerobic bacteria. It is the drug of choice for anaerobic infection, and it is less effective for gram positive or either gram negative. Okay, and here we have you have not give much emphasis on the drugs name. We have to remember another exception from the third generation of drug, which I will discuss when the third generation of drug will be discussed subsequently. Now third generation, it is for gram negative infection. Drug of choice, community acquired gram negative infection. Now in this group of drug there is also route of administration of two type, oral and parenteral. In oral we have cefixime. Here zim or ime word coming in the last. Cefixime. Next drug cephalosporin. Cefixime or cephalosporin. In parenteral route there is drug ceftriaxone, axon, cefotaxime. So we have to remember that in the last, if the drug ending with IME or ONE, then it is included in the third generation of cephalosporin. And now it is the drug of choice for community acquired gram negative infection. In community, for example, you have to remember, we can remember very common infection such as E. coli, typhoid, meningococcus, gonococci, and except here you have to remember this thing, pseudomonas. We have different group of drugs for pseudomonas specified, which will be discussed in the video subsequently in later section. And here we have to remember that the trick is IME or ON. Drug ending with IME or ON is included in third generation of cephalosporin, and there is also exception. The drug, I have marked it in black pen, cefuroxime. It is though it is ending with IME, but it is included in the second generation of drug. So it is very important to remember that so that we don't get confused in exam. And now for pseudomonas, we have the drugs called ceftazidime, cefoperazone, and ceftolozane. We have to remember these all the three drugs because it is very important. And how can we remember? What is the trick? The word Z is included in the name of the drug, so trick is Z letter in name. Now fourth generation of cephalosporin. Spectrum, it is also for gram negative infection, but the infection which are resistant to ESBL. Now what is ESBL? ESBL is extended spectrum beta lactamase enzyme. It is a method of resistance which the bacteria acquire to prevent the action of the antibiotic. So resistant to, it is the drug of choice for nosocomial infection. Nosocomial means hospital acquired. The drugs are, here we have to remember two drugs. First is cefepime and second is cefepirome. We have to remember only these two drugs in this section. Next, fifth generation of cephalosporin. It is for MRSA, methicillin resistant Staph aureus, and it is only, here we have to remember also the two drugs name, ceftaroline and second ceftabiprole. Now the much more focus in the should be in the name of the first class of drug starting with cepha, and here we have to remember at least cefazolin. Next, here we have to remember that drug in third generation, drug ending with IME and or ONE, and we have to remember also the two exceptions, that Cephaclor, although starting with Cepha, but it is included in second generation, and Cefuroxime, although ending with IME, but included in second generation. Here we can also remember that Cefuroxime axetil is the prodrug form which is given orally, and it's Cefuroxime, the active drug form, is given in parenteral mode. Now for Pseudomonas, ceftazidime and cefoperazone and ceftolozane, these drugs are given. Although it is a gram-negative infection, but you have to remember that it is an exception, and it there is a separate group of drugs for the treatment of the Pseudomonas. So we have to remember the drugs ceftazidime, cefoperazone and ceftolozane. The Z letter is included in the name. Now for fourth generation of cephalosporin, spectrum gram-negative infection resistant to ESBL, that is extended spectrum beta-lactamase. Here two drug, and here the trick is in the name there is pi. In the name of the drug there is pi. So cefepime or cefepirome. And for fifth generation of cephalosporin, and we have to remember that also the two drugs ceftaroline and ceftabiprole. Ceftaroline, here the trick is in the name there is rho, there is rho. So this is the classification of cephalosporin. Now we have to certain information regarding a special drug, cefoperazone. What is the information? At first, it is safe in renal failure, because it is excreted in bile. Also, as it is excreted in bile, there is chance of jaundice, hyperbilirubinemia, carnicterus in neonate. Second, there is in the cefoperazone there is a mechanism of reducing fibrin level, decrease fibrin level. So there is increased risk of warfarin bleeding. Why? Now we have to know why there is a reduction in fibrin level, because in cefoperazone there is MTT ring, methyl thiotrazole. Though we have to not remember, but for MCQ it is sometimes asked that MTT ring, why it show reduction in fibrin level. It is due to MTT ring. I am going to write the name MTT, methyl thiotrazole. And third point we have to remember regarding cefoperazone is it also show disulfiram-like reaction. So it is avoided in alcoholics. Now this much for today. In the next video we are going to discuss another important topics, and the note is totally covered in this image. Bye.